And it's the Newsmaker Show. I'm Brian O'Neill. We now have on our Newsmaker line Hornell Fire Chief Frank Brozowski. Chief, thanks so much for coming on.
Our pleasure.
Chief, if you can tell me, what are you doing differently as opposed to normal fire department work, which things have just changed so much with the COVID-19?
Everything's changed, as everybody knows, and we have to do things on a different outlook now from what the norm is. Certainly, we still have to keep our daily operations up, and we are doing that as far as what we normally do between EMS and our fire and responses. As you know, we are one of the bigger information centers for EMS and safety. We do quite a few classes and such out of here, and as everybody else, we've had to cut back on a lot of the training and stuff. But moving forward, we're making sure that the essential items for the public safety are still in place. With that being said, there's a lot of things that we have to do now that we have to change from what we would normally just go on a call and make sure we have all of our precautions in place for this COVID-19 response that's going on right now. And that has to do with not only the protection of my workers, but for the protection and the safety of the people out there, that we're not cross-contaminating anybody. And so it does. It brings in a new realm of how we operate. This COVID-19 is new. It's new to everybody. And on a day-to-day basis, it's changing. So as trickle-down information comes to us through our channels of what we should or shouldn't be doing, we are making those updates as rapidly as possible to make sure that we are delivering the most effective care and taking care of the public as we should. It's been a task at best, to make sure that we have the safeguards in place. As everybody knows, a lot of the different supplies and stuff that are out there are limited, so we have to watch our resources. We are very lucky here in the Canasteel Valley. I can't say that enough. The groups that work together, we have a information line here that is bar none across anywhere else in the country. With the Canasteel Valley and the Canasteel Valley response units between both volunteer agencies, north and south of us, we keep a pretty tight corridor on what's going on. Hey, did you hear this? Did you hear this information? And we pass this on between each other. So we have a good working relationship up and down the valley, which helps keep protocols in place and make sure that everything is working properly like it's supposed to.
Talking to Hornell Fire Chief Frank Brozowski. Are there more ambulance calls now? Are because of COVID-19? Maybe less in some cases. How is that working? It's been a challenge. Again, we had a couple unique things happen simultaneously. One with our area switching with U of R, and it was a great partnership, but we had to learn some new techniques, and we had to learn some different protocol changes, I would say, on how we operate when we started to tie in with U of R and how we do like interfacility transfers and different hospitals for different protocols and conditions on specific patients, first of all. And then in the middle of that, we had, as you know, a hospital move. So we switched from our hospital here in the city to just outside the city, and a beautiful facility that was built. But again, some changes from how we operated down below to up above. And as this move was transpiring and getting them settled into their new building is when COVID hit. So at the same time of learning and adjusting to a new facility, having to adjust at a new facility with these new protocols in effect for this COVID-19. So a big change as far as calls. When you say calls, it's kind of been an escalator ride. It's been up, down, because we were quite busy with the move and shifting to the new facility and stabilizing, and we had to stabilize both facilities for a period of time to make sure that anybody that would come to the old hospital was their medical needs were met. And we had standby units around the clock down there for a 2-week period to make sure that there was no misnomers, that somebody didn't misdirect from the old facility, and we got them to the new facility. So that took a lot of man hours and a lot of transports back and forth. And that kind of, after the first week, slowed up a little bit. And then it was more concentration on the new facility and what we were doing there. And then the COVID outbreak hit. So we had a little bit of a lull, and now we're on a little bit of an increase again. So the calls are picking back up because of the COVID. But more or less, it's been a roller coaster, up and down, up and down. I won't say that there was been a continuation of a steady flow of increase of calls.
When you walk around the fire department, the fire station hall there, and when you go out to meet the public on your different fire calls and ambulance calls, is it masks and gloves all the time? Is that how they're dressing?
And again, this was a change. Initially, we were told, and I caution people, this is one of the big things, where you're getting your information from to make sure it's pertinent information, because there's a lot of stuff, social media and stuff out there. You should be staying to the guidelines of the people who are in business to do this, and that's, strictly the CDC, the Department of Health. Their word is gold, and it's updated daily. So when we started, it was more or less, if we had a suspected respiratory or infectious case, we were gloving and masking up. Now we are doing it continuously because we found out, and again, through other agencies, and as this has started to come across our country, realizing that it's not always signs and symptoms that you're seeing that you have carriers. There are people that are carriers but don't present with the normal signs and symptoms, and that's with anything. People have heart attacks, people have strokes. We have a baseline that we follow. Certainly, it meets the indicators for what we should put a protocol into effect for, but they don't always present the same way. So, to err on the cautionary side, we are making sure that we are gloved up and masked up on all calls now. Certainly, if we know we have a positive case, we are that much more gingerly with it as far as making sure that all of our pieces of BSI are in place. But we are masking up and gloving up, and this was, again, on the recommendations from CDC and DOH to make sure we are at all times. And it, again, as I reiterated, it's not only for our safety, but for patient safety. Some of these patients are already in weakened conditions, and just normal bacteria and stuff, the more that they can pick up, the more difficult it is for them to fight off these diseases and stuff, because it's not uncommon to have COVID and have something else going on, and that's what's knocking a lot of these people down, especially the very young and the very old, if they have underlying conditions. So now we are indeed masking up all the time.
Talking with Hornell Fire Chief Frank Brozowski. Frank, unfortunately, Hornell has become the epicenter in Steuben County for this. What's that like to work with?
And everybody thinks that it was here and we had it. And again, there was a lot of misnomers out there as far as where this is coming from. It can be transmitted in any form or fashion. And unfortunately, it's not that the people of Hornell had this and it was here or it came to Hornell. What a lot of it was when they put the protocols into effect and said, we don't want you working anymore, we want you clearing back, we want people to use their standoff protocols as far as personal space and keeping from large crowds, not bringing it to the work environment, and shut down a lot of jobs that were not essential initially, and sent people home. A lot of these cases that came in the area weren't here already. They came from out of the area, people that I don't want to be in New York City right now because this is a bad thing, so I'm going back to my little hometown, or I don't want to be in Rochester, I'm going back to my hometown. So some of these came back in that fashion, and again, it put a strain on our system because not to say that we weren't geared up for it, but this was an unknown to everybody. And as I said earlier, with the move from the hospitals at the time, and we had so much going on at the same time, it did put a big strain on it. The other problem is the normal resources that are there for us on a day-to-day basis. People, again, the community have been great. All we have to do is make a phone call, and they will help us in any fashion they can. But the norms that are there, the hardware stores, the supply centers and stuff that are normally open, that you just run around the corner and get what you need, aren't necessarily there with full staff or full supplies like they normally are. So that has put a little bit of a contingency on us too. The way the supplies come in that we order and stuff, we have to be constantly thinking ahead and planning for not necessarily what we really know. On a day-to-day operation here, we know what our volume of calls are, what our supplies are needed for. On this, it kind of shot off the numbers a little bit, so it was a little bit more difficult to plan for. We do have some supplies in stock, and we do have enough to carry us for some time, but it treated a lot of unknowns that we weren't used to working with that we had to kind of gear up for this.
Talking with Hornell Fire Chief Frank Brozowski. We're going to take a quick break. We'll check the forecast. We'll be right back. And remember, coming up at 9 o'clock, we're going to go to St. James Hospital on our Newsmaker line. It'll be the hospital CEO, Brian O'Donovan, and Dr. John Robshaw and Dr. Ismail Mayer. Stay with us.
Lamax Pro Wrench Tire and Auto Center and Body Shop are open for business 6 days a week during this corona crisis. Think of Lamax for new tire sales, major and minor repairs, and the best fast oil change in Hornell for only $19.95. Lamax has served the Hornell area for 50 years and will continue to serve the motoring public with great values on cars and trucks. Their Pro Wrench Body Shop manager, Chris Doran, will handle your auto body work quickly and compile all insurance claims completely. Buy your next quality used car, truck, or van at LamaxAutomax.com. That's LamaxAutomax.com. Thank you from everyone at Lamax, 193 Seneca Street, Hornell. Phone 324-4440. That's 324-4440 for Lamax, Pro Wrench Tire and Auto Center and Body Shop.
Checking in now with meteorologist Rob Carolyn. Rob, we're staying inside, but how's the weather look for what it's going to be like outside today?
Well, actually, outside's not going to be bad at all today, Brian. We're in between two weather systems, one producing a sizable snowfall across the Dakotas today, and another, a powerful storm east of New England that is south of Nova Scotia. In between, we have this narrow strip of high pressure, and it's going to be sitting over the southern tier. Now, we will see a little bit of cloudiness today. Most of the clouds, though, remain off to our east in the eastern third of the state. They'll creep our way tonight. Actually, kind of strange they're coming in from the east, but that powerful low out in New England is actually going to throw moisture back towards the northeastern United States. It'll then move away from us on Saturday, and we'll see improving weather conditions. Today, sunshine, some passing clouds. Breezy, we're 45 to 50. Tonight, partly to mostly cloudy, 35. Clouds and maybe a stray shower or sprinkle tomorrow. The precipitation does not look very heavy if we get it. Temperatures 45 to 50. Tomorrow night, clouds 35 to 40.
And we're back. Thank you, Rob. We're back with Hornell Fire Chief Frank Brozowski. Chief Brozowski, state police say that statewide there are 30 sick state troopers. I was wondering, do you have any sense of the firefighters statewide and how many of them have gotten COVID-19 statewide?
I don't know statewide offhand. I haven't been watching those numbers. We have been telling our guys, and I know through the chain that we've been trying to keep people as healthy as possible. And there again, some things are unavoidable by carriers through family and stuff. But
that's one of our biggest fears because we are on the front line, first responders, EMS, fire, and police, and that could be a travesty if it gets into one of the loops, especially smaller departments like ourselves. If we lose members, that puts a real strain on a system that's already being strained to the max of where it's at. And as I said, we've put protocols and such into effect to try and limit exposure and also monitor it very closely as far as who comes in, who doesn't. As far as our station, it's pretty much where the fire station is always a spot for the community to come in, bring their kids in, tours. The station's on a lockdown right now. No one gets past the front door unless it's necessity, and that's a real heartbreaker for us. But due to the times, it has to be. So we try to limit exposure as much as possible and keep track of that. But as far as the numbers, I don't know what they are statewide. I know we many departments have said they have department members off right now, and we're trying to keep a close eye on that for the sake of the frontline people.
Fire Chief Frank Brozowski, looking at the Steuben County COVID-19 map, Hornell has the most cases, followed by Hornellsville. North Hornell, I believe, is it 3 cases? Correct me if I'm wrong there. When you go out to your calls in Hornell and you go outside of Hornell, we talked about that earlier, masks and gloves. Is that on all calls or on calls when you're not sure if someone has COVID-19 or not? Or is that all calls?
It used to be not sure, but now it's on all calls because we just can't take the chance of knowing, who has what and who's in the mix as far as where they came from. They could have come from somewhere else, like I said, out of the area. Initially, when we were doing this, it was not, but now it is on all calls. And when we try and monitor that as closely as possible, with reason. I mean, if it's a fire call and the guys are out in the street or somewhere where they're not in any danger of exposure to anybody else, they might not have one on. But anytime they're responding to an ambulance call or with another person or in a house or such, one of the residents, then they are masked up all the time. And that's just, again, the guidelines for what we were given and what we were supposed to be doing to monitor that. The other thing is all of our equipment, where we normally have, if we know we have an infectious disease or somebody that might be a carrier on a normal day-to-day operation, we bring the rig back after the call, and it's the equipment is wiped down and cleaned and put back in service. And most of the time on a day-to-day, when you're dealing with somebody with maybe a broken arm or a broken leg, I'm not so worried about, we can go a day and clean the rig on a daily basis and we're good to go. With this, every time we actually have a rotation as the crew gets finished up with a call, the patient is either, if they're seen at the house or dropped off at the hospital, the rig is immediately cleaned and wiped down. When it returns to the station, it's disinfected, wiped down, and cleaned before it's put on the line for the next call. So we keep the rigs rotating constantly, and the guys are pretty efficient on that as far as monitoring that also, which, again, it's another strain on the system, but we're watching every avenue that we can to keep this spread down.
Governor Andrew Cuomo has called on retired doctors and nurses and retired medical professionals to come out of retirement to help out with the situation in New York State. You spoke earlier of the strain on the fire department that would happen if any of the firefighters did come down with COVID-19. Are there any local retired firefighters that you might be able to call on if a situation, we hope, God forbid, arose, but if something did happen, would you be able to call on any local firefighters, Frank Brozowski?
We have a few, and we have a few options available to us through mutual aid and stuff that we can do. We have aligned I will say, a skeleton plan at this point to have backups in place because certainly this could happen. And as you said, we're hoping for the best and that it doesn't. As everything we've done so far with COVID, we plan for the worst and hope for the best. No one can have the options of everything, but yeah, there are certainly people out there that we could contact, and I know would be more than willing to step in them roles and fill some of those slots. Hopefully we don't get to that point.
We've been speaking with Hornell Fire Chief Frank Brozowski down to the last 60 seconds or so. Was there anything I did not bring up that you'd like to say to the general public, Fire Chief Brozowski?
Just as the CDC and everybody's been telling everybody, take this seriously. This is a serious threat to everybody. We will get through this. We'll get back to good times in normal life. Stay home. Keep hand washing, sanitizing. Keep clean. Don't go out. Don't venture out. Don't get in crowds. Don't go out any more than you have to. Stay put. We'll get through this next a few weeks of this criteria, and just keep tabs on the CDC and the Department of Health websites. If you need any information, and certainly anybody is more than welcome to call here at the station if they need any information. But if you don't need to venture out, stay home.
I want to thank you so much, Chief Brozowski, for coming on today. That was very good of you. By the way, the fire chief came on because we had a cancellation of another guest, and he's a busy guy. So thank you so much, Chief Brozowski.
You're more than welcome. We appreciate it.
Thank you very much. It's AM 1480, WLEA Hornell.
Gordon Deal, 5 till 8:30. The Newsmaker Show after the 8:30 news. The Brian Kilmeade Show, 9 to noon. Bill O'Reilly, 11:45 a.m. till noon. Rush Limbaugh, noon till 3. Sean Hannity, 3 to 6. Dave Ramsey, 6 p.m. to 9. John Batchelor, 9 to 11. Jim Bohannon, 11 to 1 a.m. Coast to Coast AM, 1 to 5. AM 1480 WLEA Hornell, where it's news first and fast.